Excellencies, dear colleagues and friends, thank you for the opportunity of joining you today, albeit virtually. COVID-19 has demonstrated that a pandemic is so much more than a health crisis, with lives and livelihoods destroyed and societies and economies upended. More than 6 million people have died, health systems have been disrupted, and for the first time this century, we have seen a rise in the number of people living in absolute poverty. While epidemics and pandemics are a fact of nature, they are exacerbated by urbanization, encroachment on habitats, the climate crisis, and insecurity. It's certain that COVID-19 won't be the last pandemic, but how likely is it to occur? And how much damage it causes when it does? Those are areas over which we have influence. We must learn the lessons of this pandemic. Let me offer 3. First, it's essential to strengthen local production of vaccines, particularly in low and middle-income countries, to increase their independence and foster autonomy. In many countries, vaccines have helped to turn the tide on the pandemic, saving lives and protecting health systems. But as we speak, more than 80% of the population of Africa is yet to receive a single dose of vaccine, and the gap in access to tests is even worse. It has become obvious that equity cannot be left to market forces, or the goodwill of donors, or shifting geopolitical currents. Expanding local production of vaccines and other health products is a high priority for WHO. Recently, we have established the WHO mRNA Technology Transfer Hub in South Africa, which has now developed its own vaccine candidate. So far, 13 low and middle-income countries are set to receive technology from the hub to produce their own mRNA vaccines. The second lesson is that a resilient health system is not the same thing as an advanced medical care system. Health systems have been badly disrupted, including services for reproductive, maternal, and newborn health services, as well as routine immunizations and care for non-communicable diseases. For too long, too many countries have invested heavily in sophisticated medical care, but too little in public health. As a result, their health systems were overwhelmed. The backbone of public health is robust primary health care for detecting outbreaks at the earliest possible stage, as well as for preventing disease and promoting health at the community level. The third lesson is that the world needs an enhanced global architecture for pandemic prevention, preparedness, and response. In the face of a global crisis, no single country, organization, or agency can go it alone. The pandemic has once again illustrated the value of multilateralism. Instead of confusion and incoherence, we need cooperation in the face of common threats, along with sufficient resources for strengthening global health security. And we need an empowered and sustainably financed WHO at its core, playing the coordinating and normative role on which so many countries and partners depend. WHO's member states are now negotiating an international accord towards a more harmonized global response to future pandemics and epidemics, including the equitable sharing of countermeasures. We're also working with our member states to put in place new systems and tools to prevent, detect, and respond rapidly to epidemics and pandemics. New initiatives include the WHO Hub for Epidemic and Pandemic Intelligence in Berlin, the WHO BioHub system for sharing pathogens in Switzerland, and the Global Economics Genomics Surveillance Strategy. Above all, the pandemic has taught us that health is not simply an outcome of development, but the foundation of social, economic, and political stability. It's not a cost, but an investment. It's not a luxury for the few, but a fundamental human right for all. The World Government Summit is an opportunity to work together for shared solutions to shared threats and a healthier, safer, and fairer future for all. I thank you. Shukran jazilan.